Happy New Year and welcome to Healthy Kingston, a health promotion and wellness program presented by the Kingston Board of Health. I'm Janet Wade, your host. Today we have a very busy program. We will be receiving an update on the health department by Joyce Kristofolski, who is our health agent, followed by a report from the chairman of the recycling committee in Kingston, Landis-Naumann, as to special projects they are working on. I'll also be speaking about something close to my heart, Healthy Kingston Kids, which was started with the Kingston Library, followed by an update on the spike in respiratory diseases locally and nationally. So with that, Joyce, thank you for coming. It's good to have you here.
Very welcome. Glad to be here.
And please tell us what's going on in the health department.
So we have some changes. We've been working really hard to digitize all of our septic folders in hopes of making it easier for the public to access information concerning their properties. We have had recently trying to change how we go about permitting. We've sent out reminder notices to help people to be on time with making sure that they're permitted correctly. We are also instituting a class. We're going to be teaching ServSafe open to the general public in order to help smaller businesses make sure that their staff are adequately trained in restaurant safety and food management. So that'll be occurring at the end of January. We're going to send out notices to all the currently permitted establishments. And then anybody else who's interested in attending will have spots for that as well. The cost of that will be $80, and that includes your study book as well as the exam sheet. And at the end of that, should you pass, you will be a certified food protection manager, which will definitely help people who are in the culinary industry to work effectively. So hopefully this will be a nice start of a new program that will continue if this first class is successful.
That's wonderful. So even for people who would be interested in the food industry who aren't actually working within it yet?
Yeah. So we'll be sending it out, and if anybody is interested and sees this program is interested, please feel free to contact the health department directly. You can stop by or give us a phone call. We will be collecting the $80, and once you've paid up to reserve your spot in the class, you'll receive a book, which will come with the instructions that you actually need to read the book prior to the class. It is an 8-hour class, and it is a lot of information. I think that especially for someone who has limited or no experience in the culinary segment, it's best to read it cover to cover, and there's little practice exams in it. It will make the class much easier because you'll have already heard some of the terminology, understand where the parameters are for safety. So it'll just make your class experience a lot easier. It's always a great review or refresher for anybody who's already been in the industry. And I believe it's the last Monday of January, which I believe is the 29th. But anybody with any questions should absolutely feel free to call the department or email us, and we can provide more information.
What is the certification through?
So the ServSafe certification is provided through the National Restaurant Association. It's a nationally recognized certification. It covers things like proper food handling, proper temperatures, storage, correct equipment use, overall chemical safety, how to sanitize. So all the little components that make working in the culinary industry safer, not only for the employee, but for the person, for the fact that you're serving food to the general public. Mm-hmm. So
that's tremendous. Are you having it at the town hall?
We are. It'll be in the large room upstairs in room 200 to provide lots of space, and we'll be able to put up the PowerPoint presentations. I have a PowerPoint presentation that I use with it while we discuss the book to help visual learners to be able to see the information as well.
Great. And we'll have the information on how you can register and numbers for the health department on the screen. So That's wonderful.
Some,
Any other news?
well, we will be doing cholesterol screenings at the COA. I believe it's going to be every other week, and that is being performed by our absolutely spectacular grant nurse, Pat Iafrades. She also does blood pressure clinic at the COA as well. Super helpful. We're providing cards for our residents to help them be able to track their blood pressure, and we work with them around medication so that they have a current list. So should they have an emergency, everything's in one place. We recently got some cards made to assist with that. In addition, we're looking to try and plan a health fair for the spring, which we will be inviting local businesses to participate, anyone that has anything to do with health, as well as organizing a blood bank, a blood donor bank as well during this whole fair, so that it's sort of like one-stop shopping.
Wonderful.
So that will be hopefully late March, early April. We're trying to get it at, when it's boring out and the weather's finally broke, but not so great that everybody's outside having a ball.
Right.
So trying to hit that sweet spot.
Yeah,
So
we'll
that's
certainly
hopefully
promote
in
it.
the works. We're aiming for that.
Terrific.
Yeah. So
Okay. Well, certainly active department, and
trying.
you've been doing a wonderful job, and thank you for all you do for the community. It's very much appreciated.
I'm very much enjoying my position here at Kingston. So
Great.
it's been a pleasure to join the department.
Next, I'd like to introduce Jean Landis-Naumann, who is chairman of the Recycling Committee here in Kingston. She has a lot of information she would like to share with us about what's going on with that very active committee.
Thank you, Janet.
Sure.
First, I want to talk about our New York kitchen organics recycling. After a successful pilot, a 3-year contract was signed with Black Earth Compost. Any resident with a transfer station sticker or recycling-only sticker can participate. A list of all the acceptable materials is available on the Recycling Committee page of the town website. Residents only need to separate their organic material and deposit it in the green totes near the composting area at the transfer station. Material is picked up weekly and composted in Framingham. This is some of our heaviest trash and certainly is better composted than incinerated at CMAS. For this spring, the Recycling Committee is working on a rain barrel sale, as well as working with other departments and committees to offer a native plant sale. Next fall, there will be a designated area at the transfer station for residents to leave viable mums and other fall plants, as most of these can be replanted to bloom several more years. Check the pink insert in your recent water and sewer bill for important information on lithium-ion batteries. And the recycling information is always available on the Recycling Committee webpage, and residents can always contact the Recycling Committee if they have any questions. Our committee meets the first Tuesday of the month, and we always welcome visitors either in person or via Zoom.
Wonderful. And we'll certainly have contact information for your committee on the screen, so people can
It
easily
would
access
simply
you.
be the contact on our webpage,
Okay. Which you can get on the town website.
the town website. Yeah.
Okay. Wonderful. Busy. All really good things.
Yes, and we're so fortunate. We have Paul Basser, who's the superintendent of streets, trees, and parks, who's in charge of the transfer station, as well as our municipal assistant, who comes from DEP. They both regularly attend our meetings. And we've begun having attendees from other communities, too.
Oh.
And we've had some inquiries from other communities regarding the organics collection.
Terrific. Well, that certainly says a lot for your committee.
Yeah, this is a dedicated group. We can always use additional members. As you can see, there's plenty of activities involved, and many hands make easy work.
Right. Thank you so much for
You're
being with
welcome.
us.
Thank you for
And
this
thank you
opportunity.
for all your good work for the community.
Thank you.
I'd now like to promote a program of which I'm very excited. The Board of Health has been working with Holly Iannucci, the children's librarian at the Kingston Library, on a new program that's called Healthy Kingston Kids. It's an interactive program where children between the ages of 3 and 8 can go into the playroom. There are a fair amount of health materials that are in there. There's doctors and nurses' medical bags and the equipment that goes with them. There's also a medical office. There are patient gowns that the children can play patients with, and there are also jackets and coats for the upcoming nurses and doctors who may be inspired by this equipment. So it's a lot of fun equipment, very interactive, dolls that can be used as patients as well as the children themselves. So please check it out if you have a young child. I also want to let you know that Holly Iannucci is going to be doing regularly, probably monthly, health-related story times and a health-related activity that relates to that story. So be on the lookout for that on the library website. And one other thing I want to tell you about, which I'm personally very excited about, are backpacks that moms and children can check out. And they involve several different health topics, including nutrition, exercise, and the human body. And in these backpacks are a series or a number of interactive activities that parents or caregivers can do with children, from puzzles to books on the topics, games. So, and you can check them out and have a little playtime with your child. So please be on the lookout for those. As the new year starts, hospitals are seeing a rise in respiratory infections, including the flu, COVID, RSV, and the common cold. This season, the Centers for Disease Control reports that over 7 million cases of respiratory illness have occurred so far, and 4,500 flu-related deaths. The COVID rates are the highest they've been since last January. Since last November, there's been a 200% increase in cases of the flu, 60% increase in RSV, and 50% increase in COVID cases. This can be attributed to the fact that it's colder and we're more physically contained. Also, only 18.5% of population has updated their vaccinations. Having COVID also diminishes our immune systems and makes us more susceptible to other illnesses. The new COVID subvariant, JN1, mutates quickly, and in November it accounted for 3% of cases of COVID. It now accounts for 50%. The symptoms, treatment, and prevention are the same as the COVID we've been used to. Those at the highest rate for COVID-19 are adults over the age of 65, and the flu is more prevalent in young children. Precautions for these illnesses remain the same. If you're not feeling well, stay home. Cover coughs, social distance when necessary, and use a mask. Practice good hygiene, especially frequent hand washing.